Hi, I'm Shirley Rose, and this is Joe Costello. Welcome to Balanced Health, Your Body, Your Choice, a show dedicated to helping baby boomers live healthier quality lives through a simple, balanced approach to health. Heart disease is the #1 killer of both men and women in the United States. Yet many people don't recognize the early signs of a heart attack. And 63% of women who die from coronary heart disease had no previous symptoms, and that's really scary.
Yikes.
But both modern and holistic medicine concur that there are things we can do every day to keep the heart healthy. Joe has our weekly dose of nutrition in the news, but in a minute. But first, I want to just give you some statistics that are really shocking. And by the way, we're so happy to have Dr. McKeever here with us again.
Welcome,
you, Dr. McKeever.
Nice to be here.
It was so wonderful having you the other show that we did together, and so we're looking forward to hearing from you more today. But you were telling me some things, and we have some statistics I want to give. Every 20 seconds, someone in the United States has a heart attack. Every 20
since the show
seconds.
started, there's 2.
Well, yeah, at least. And 1 in 4 Americans has some form of heart disease. Every 34 seconds, someone in the U.S. dies of heart disease. But listen to this. This is unbelievable. Heart disease takes more lives than the next 16 leading causes of death combined. That would be all forms of cancer. You know, that is amazing. And this one, yeah, and this one Dr. McKeever just gave me. If we could eliminate heart disease, the life expectancy would go up 10 years. If we could eliminate all cancers, the life expectancy would only go up 3 years. And yet cancer is the thing that we're so afraid of, and heart disease is the thing that's killing Americans. It's amazing.
Well, Shirley, in that battle against heart disease, and what we're finding out is something that is not really new on the scene, but something that is becoming more prevalent, and that is called CRP. CRP is an acronym for C-Reactive Protein, and that's what we're going to talk about today in Nutrition in the News. C-reactive protein is a plasma protein produced in the liver in response to inflammation. Because narrowing of the arteries goes hand in hand with inflammation, elevated CRP is considered an important warning sign that cardiovascular problems may be in the works. So, one of the things we want to do is avoid this inflammatory response in the body. This is an interesting study. Researchers have associated weight loss, exercise, no surprise there, and an intake of vitamin C and omega-3 fatty acids with a reduced risk of inflammation and consequently reduced levels of CRP. Now, one thing we always got to be careful of in studies is studies give predominantly what we call relative values, which means if they say there's a 20% less, it reduces your chance of a heart attack by 20%. What it doesn't give you is the absolute value. So what does that mean? If your chances of a heart attack to begin with were 1 in 10, and you just reduce them by 20%, now your chances are more like, say, 1 in 14, okay, or 1 in 12, I'm sorry, 2 being 20% of 10. And relative values, if you only had a 1 in 10 chance of having a heart attack to begin with, and you just decrease it by 20%, what is still your overall chance of having a heart attack?
Pretty low, huh?
Well, that's what these things don't really tell us.
Yeah.
So they leave out these absolute values, and we always get these relative values. The point, though, is still this, and I think this is what's key. The fact that things like weight loss, exercise, and supplements, nutritional, eating properly, like omega-3, actually reduces the risk of inflammation. Doctor, what I'd like to do here is throw to you and say, to talk about CRP, talk about this inflammation, and we'd like your take on what you think about these studies that show supplements or nutrients in food reducing those risks.
And could I just ask before you answer that, how do you know what your levels are? How's that evaluated?
Well, you could take on a blood work. Unfortunately, a lot of times it's often taken when you think someone's having a heart attack, right?
Yeah, it's a blood test that's measured. CRP is what we call an acute phase reactant. So any inflammatory process will raise the CRP, and we've used CRP to look for inflammation for many years. A large study was done in the last few years that showed that a high percentage of patients who had an elevated CRP, were destined to get coronary events. The reverse is not known, though. If we treat for high CRP, will that translate into lower cardiovascular events? And the answer is, we don't know. The study really hasn't been done.
So really does it really benefit us to know that?
It's good for epidemiologic studies, but we don't use it in day-to-day practice for individual patients because we don't really know what to do with the information. If it's elevated, you worry, but what are you going to do about it?
Yeah.
The more tried and true preventive things that we do, measuring cholesterol, if that's elevated, treating that will decrease your inflammation. Keeping your blood pressure down will decrease your inflammation. Okay. So the other risk factors that we traditionally measure and then treat will affect the CRP in a favorable way.
But those other things that you're talking about, when you take in this blood work in an unremarkable setting, just in an office environment, that's one whole scenario. When you think somebody might be having a heart attack, or they think they might, they come into the ER, they do an EKG, that's normal. Enlighten me on this. They draw some blood and they look for a particular elevated enzyme. I might not be asking the right question, but that enzyme being elevated might indicate a heart attack when in fact an EKG might not?
That's right. The enzyme there are several enzymes that leak out of the heart when the heart is damaged during a heart attack. And these enzymes are then measured in the bloodstream. And if they're elevated, they're a clue that there's been damage to the heart, recent damage. There's several enzymes, troponin, CPK, SGOT. They're proteins that are in the heart cells that leak out when the heart gets damaged.
So with that elevated reading, say in an ER setting, will that send you to the next level of intervention?
Absolutely. Okay. That's a heart attack, and time is muscle. Yeah. So the sooner we treat the heart attack, the less muscle that is lost.
Well, that's probably why when I went to Edward Hospital, because I thought I might be having it, the first thing to do is take blood.
What you thought was that, and that's why I brought that up. For the viewers saying, why would they draw blood?
That's exactly what they were doing. They were measuring for.
Interesting. Well, in order to get your body to the fat burning zone in a workout, you have to reach your maximum target heart rate. Or do you? After the break, Joe's going to explain why you may be able to start your cool down a bit earlier. Stay tuned for Debunking the Myths. We'll be right back.